Regain your leg strength in just days. The secret to the 3 vitamins your doctor never mentioned. Have you ever wondered why your legs feel heavier with each passing year? Is the difficulty getting up from the chair really just a consequence of age? What if there was a simple solution that your doctor never mentioned? Perhaps you've noticed how climbing stairs has become a challenge similar to lifting weights. Or how occasionally he loses his balance as he crosses the living room. Most people simply accept this as part of normal aging. But what if I told you that these signs are not just of age, but indicators of a specific condition? What you'll discover in the next few minutes can completely transform the way you move, feel, and live after the age of 60. And the best part, it does not involve strenuous exercise, expensive therapies, or invasive procedures. Here's the news that will change your life. Research has shown that leg strength can be restored in a matter of days with the help of just 3 essential vitamins. No strenuous exercise, no expensive therapies, just the right nutrients at the right time to restore your independence and confidence when moving. Let's get started. Are you losing strength in your legs without realizing it? The alarming signs that everyone ignores. Have you noticed that your legs are weakening after 60? To get up, you need to push with your hands resting on your knees. Climbing stairs has become a challenge, similar to lifting weights. Occasionally, you lose your balance even as you walk across the living room. Most people simply accept this as part of aging. But here's the truth that few know. In reality, these are the first indicators of sarcopenia, age-related muscle loss. And the most worrying, this happens in silence, without pain or swelling. You only realize it when you need help getting up from a chair. Most alarmingly, this silent process is robbing you of your independence without you even realizing it. But it can be reversed with simple interventions that many overlook. But here's the good news that few doctors share with their patients. Studies have proven that leg strength can be restored in a matter of days with the help of just 3 essential vitamins. No strenuous exercise, no expensive therapies, just the right nutrients at the right time. What you're about to find out isn't health rumor or speculation. It is based on clinical investigations, real research, and decades of professional experience. You'll discover a strategy that most people are unaware of, but which is extremely effective. But before I reveal these 3 miracle vitamins, I need you to understand exactly why your legs are weakening. Only then will you be able to understand how this solution works so effectively. You'll be surprised to find out that it's not just the natural aging process. The surprising truth, why your legs weaken, and it's not just age. Your body undergoes a gradual but noticeable change after the age of 60. Your bones become more fragile and break more easily. Your blood circulation slows down significantly. Your muscles begin to weaken, particularly those in your legs. Most people don't know that the legs usually experience the initial weakness. This makes simple tasks like standing up or walking surprisingly difficult. Even if they are eating normally and feeling well, people over the age of 60 lose 1 to 3% of their muscle mass annually. This means that you can lose up to 15% of your leg strength in just 5 years without even realizing it. This is a fact proven by the American Geriatric Society that few know about. The shocking truth is that you may be losing strength in your legs even if you follow all the traditional health recommendations. And this silent loss is compromising your mobility day after day. So why does this happen when you seem to be doing everything right? There are 3 main causes that doctors rarely discuss with their elderly patients. The first cause is the vitamin deficiencies that occur naturally with aging. Our intestines absorb nutrients less efficiently as we age. Our stomachs produce less acid as the years go by. This results in low levels of vitamins D, B12, and B1, thiamine. All of these vitamins are essential for nerve transmission and muscle contraction. The second reason is poor blood circulation that develops gradually. When your circulation is slower, your legs receive less oxygen and nutrients. The result? Early fatigue, frequent cramps, and heavy and tired legs. The third reason is the reduction in physical activity that accompanies aging. Older people tend to walk less or avoid stairs for fear of falls. Over time, the leg muscles weaken and shrink as a result. In addition, without proper nutrition, muscles cannot fully regenerate. Even with regular movement, muscle recovery is compromised. It is a negative cycle that feeds itself, but it can be interrupted with the right strategies. Now that you understand why your legs are weakening, let's identify the warning signs you should never ignore. These signs are like whispers from your body asking for help. And the sooner you hear these whispers, the faster you can reverse the process. Red alert: deficiency symptoms that are sabotaging your mobility. Have you ever had the feeling of heavy legs at the end of the day? Or have you noticed that you need to hold onto the railing to climb stairs safely? These can be early signs of specific vitamin deficiencies. There are clear symptoms for each of the 3 vitamins essential for leg strength. Let's look at the warning signs you should look out for. How many of these signs have you experienced without realizing their true cause? For vitamin D deficiency 3, signs include weakness in the legs, especially when climbing stairs. Exhaustion after standing or walking for short periods. Leg cramps at night that disturb your sleep. Difficulty turning or taking quick steps when necessary. Intense pain in the hips, knees, or heels with no apparent cause. Some people also experience mild anxiety and irritability. These seemingly unrelated symptoms are actually early signs of a correctable nutritional deficiency that is quietly undermining your mobility and independence without you even realizing it. But they are often confused with normal aging and ignored. For vitamin B deficiency 12, symptoms include burning, tingling, or numbness in the feet. Weakness in the legs, particularly when standing or walking. A strange sensation that your legs are not responding to brain commands. Difficulty maintaining balance even on flat surfaces. Feeling unstable or needing assistance when walking. Some people also experience mood swings, mild depression, and forgetfulness. These symptoms appear gradually over time. Many seniors simply believe that they are getting older. In fact, they are the classic signs of a B deficiency 12 that can be easily corrected. For vitamin B1, thiamine deficiency, signs include legs that feel weak or extremely tired even with little activity. Muscle cramps, particularly in the feet or calves. A feeling of heaviness or drag when moving. Shortness of breath when climbing stairs, even if your lungs are healthy. Occasionally feeling dizzy or exhausted after getting up. Some also experience a lack of appetite and lack of motivation to move. Now that you know the warning signs, let's explore how each of these essential vitamins works to restore strength to your legs. Starting with the most powerful of these, vitamin D3. What you're about to discover will completely change your perspective on aging and mobility. Vitamin D3, the miracle switch that awakens dormant muscles in record time. Vitamin D3 is much more than just another vitamin in your daily supplement. Did you know that it works as a main switch that reactivates your entire nervous, skeletal, and muscular system? It's like the central circuit breaker in your home, controlling your body's vital systems. And here's the problem that few doctors discuss with their elderly patients. Your ability to produce this essential nutrient decreases significantly after the age of 60. Your skin gets thinner, your kidneys and liver work more slowly. As you spend less time in the sun, your body begins to shut down vital systems. Your muscles weaken, your legs become heavy, you move slower. And more worryingly, you start to lose your balance because of this subtle deficiency. Most people don't know that vitamin D3 is the silent conductor that coordinates all the muscles in your legs, and when your levels drop, it's like an orchestra playing without a conductor. But why is this vitamin so crucial for your legs? Vitamin D3 helps with calcium absorption, which is essential for strong, healthy bones. But that's just the beginning of its importance for your mobility. It also ensures that your muscle fibers contract properly when needed. It facilitates the smooth transmission of information through your nerves to your muscles. And above all, it prevents muscle atrophy that subtly occurs with aging. Without enough D3, your body becomes weak and unreliable, like the gears of a machine without lubrication. What does science say about this? Researchers at the University of Birmingham in the United Kingdom studied people over the age of 65. After consuming 800 international units of vitamin D3 for just 5 days, something amazing happened. The participants' leg strength increased by an average of 19%. In just a few weeks, no intense workouts or expensive therapies. Another Chinese study showed equally impressive results with D3 supplementation. Researchers at Harvard's Center for Geriatric Research have discovered something even more alarming. Older adults with low vitamin D levels were 40% more likely to fall or be admitted to the hospital. The message is clear. Vitamin D3 protects not only your bone structure, but your independence. How does it work in your body? When your vitamin D levels are normalized, your body absorbs calcium more efficiently. It promotes the development of new, stronger, and more resistant muscle fibers. It improves muscle contraction and the response time of your muscles to brain commands. It reduces latent inflammation in muscle tissue that causes pain and stiffness. And it facilitates smoother, pain-free movements that give you back your confidence when walking. Simply said, vitamin D3 reactivates your joints and dormant muscles. It's like turning the power switch back on in the circuits of your legs. In a few days, you can feel the difference in the firmness and security of your steps. What is the recommended dosage for healthy people over 60? Experts recommend 800 to 1,000 international units daily. For people with a history of falls, the recommended dose is higher, 1,500 to 2,000 international units. Vitamin D3 should be taken in the morning or early afternoon. Always after a meal that includes healthy fats such as salmon, eggs, or olive oil. It should never be taken before bedtime, as it can cause sleep disturbances. Now let's get to know the second crucial vitamin for your legs, B12. This vitamin works in perfect harmony with D3 to restore your mobility. And what you will discover about it may surprise even those who already know its benefits for the brain. Vitamin B12, the forgotten nutrient that restores the connection between brain and legs. Let's talk about vitamin B12, one of the most important and often overlooked supplements for people over 60. B12, as you may know, is a vitamin that helps with memory and vitality. But what most people are unaware of is its crucial role in mobility. A B12 is essential for communication between your brain and muscles, particularly your legs. It helps maintain healthy nerves, coordinated movements, and quick reflexes. It's like the communication system that transmits commands from your brain for every step you take. When your B levels drop, the connection between your brain and muscles becomes fuzzy. And your lower body is often where the first symptoms appear. It's like trying to talk on the phone with a weak signal. The message just doesn't get through properly. This vitamin is the essential communication cable between your brain and your legs. When the signal weakens, your muscles literally can't understand what your brain is asking them to do. The result is a disconnect that compromises every step. Why is disability more common among the elderly? There are two main causes that are rarely discussed in doctor's appointments. The first is the inadequate absorption that occurs naturally with age. Our stomachs produce less acid as we age, especially if you take medications that reduce stomach acid, such as ranitidine or omeprazole. In this low-acid environment, it's harder to get B12 from the foods you consume. The second cause is a restricted diet that many adopt in old age. Meat, fish, eggs, and dairy are pretty much the only sources of vitamin B12. If you consume less meat or follow a predominantly plant-based diet, you're at higher risk. Your body may not absorb enough even if you eat a healthy diet. This explains why B12 deficiency is so prevalent in people over 60. It's a perfect storm: less stomach acid production and more restricted diets. What does science say about this? Numerous studies have demonstrated the impact of inadequate B12 on the mobility of the elderly. A study by the University of Oxford in the United Kingdom revealed worrying data about this deficiency. Seniors aged 65 and older who had low B12 levels walked more slowly. They had significantly worse balance and were more than twice as likely to fall in the next year. Compared with those who maintained normal levels, the difference was alarming. In the Journal of Gerontology, a randomized controlled trial brought impressive results. Older adults were given 1 milligram of vitamin B12 a day for 8 weeks as part of the research. After supplementation, the results were remarkable and immediate. participants reported less numbness and instability when walking, better lower body strength, and faster reaction times. In addition to helping you think more clearly, B12 keeps your body balanced and in check. How does vitamin B12 work in the body? It promotes the formation of the protective sheath that surrounds your nerves, essential for transmitting signals. The production of red blood cells increases the supply of oxygen to muscle tissues. Energy metabolism and fast, accurate signals from the brain to the muscles are enhanced. Thus, the muscles receive the energy they need to function properly. When you're deficient in B12, your nerves malfunction and your muscles don't understand orders. Who is most likely to be affected by B12's deficiency? If you are over 60, you regularly use antacids or acid blockers. Adopt a low-meat or vegetarian diet that limits natural sources of B12. If you take metformin for diabetes or suffer from digestive disorders like gastritis or irritable bowel syndrome. If you consume alcohol regularly or have undergone weight reduction or gastrointestinal surgery. In these cases, it is worth getting a quick blood test to determine your B12 levels. What is the recommended dosage of B12 to regain leg strength? A daily dose of 500 to 1,000 micrograms of methylcobalamin is safe and effective for people over 60 years of age. Why methylcobalamin? Because it is the active form of vitamin B12. Your body can use it right away without having to convert it. This is particularly beneficial for seniors, as conversion rates decrease with age. It's like receiving the fuel already refined, ready for immediate use in your cells. Now let's discover the third essential vitamin for your legs. Vitamin B1, also known as thiamine. This is the lesser-known vitamin of the trio, but it may be the secret ingredient that makes all the difference. You'll be surprised to find out how she can turn tired legs into energized ones. Vitamin B1, the secret fuel that turns tired legs into energized ones. You already know the role of vitamin D3 in the muscles and B12 in the nerves, but one piece is missing: vitamin B1, thiamine. It provides the essential energy for your muscles to function. Without it, it's like a car out of fuel. Everything is ready, but nothing moves. Even with strong bones and healthy nerves, the lack of B1 prevents movement. Since the legs have large muscles, they need a constant supply of this vitamin. B1 deficiency causes extreme tiredness, cramps, a feeling of heaviness, and even shortness of breath when climbing stairs. Other signs include dizziness when standing up, mental exhaustion, and demotivation. The recommended daily dose is low, 1.2 milligrams for men and 1.1 milligrams for women. For elderly people with symptoms, doctors indicate up to 100 milligrams per day, without risk, as the excess is eliminated in the urine. Take B1 in the morning with foods high in fat or protein. Avoid alcohol, coffee, and black tea. Natural sources include whole grains, seeds, and pork. However, many elderly people do not consume enough, and certain medications make it difficult to absorb. Therefore, supplementation may be necessary to restore energy, strength, and mobility. The perfect formula. Exact dosages for impressive results in just days. After understanding the role of each vitamin, questions arise about dosage, form of use, and time to see results. For vitamin D3, healthy people over the age of 60 should take 800 to 1,000 IU per day. Those who already have weakness in the legs may need 1,500 to 2,000 IU, always with medical monitoring. Vitamin B12 should be taken in daily doses of 500 to 1,000 micrograms in the form of methylcobalamin, which is more effective. Sublingual forms are recommended as they have better absorption. For vitamin B1, thiamine, the basic daily allowance is 1.1 milligrams for women and 1.2 milligrams for men. Elderly people with disabilities may need 50 to 100 milligrams per day. Results vary. With vitamin D3, many notice improvement in 5 to 7 days. B12 shows effects in 3 to 5 days, with greater balance in up to 3 weeks. B1 usually acts quickly, with energy in the legs after a few days. Most see clear improvements in the first month. Foolproof strategy. How to combine the 3 vitamins to enhance results. Now that we know the individual role of each vitamin, it's time to combine them strategically. The secret is in the right timing and simplicity. Vitamin D3 should be taken in the morning, after breakfast, with foods rich in healthy fats like eggs or avocados. This is because it is soluble in fat and depends on it to be absorbed. Vitamin B12 is ideal at midday, as it promotes alertness and, if taken at night, can disrupt sleep. Avoid combining it with tea or coffee. Vitamin B1 should be consumed in the morning with whole grains and protein to maintain energy and focus. Taken at the correct times, these vitamins act as an orchestra in harmony. For breakfast, consume vitamin D3 and B1 with yogurt and eggs. For lunch, take B12 with salmon or tofu. Read the multivitamin label. Many underdose these vitamins. Never take them on an empty stomach. Consult your doctor. Following this, you regain strength and confidence in your movements. Real transformations. How ordinary people returned to climbing stairs effortlessly. Anna is 67 years old and has always been independent and active. But in the last 2 years, he began to notice a worrying change. His legs seemed increasingly heavy. Climbing stairs became a daily ordeal that he avoided whenever possible. "I thought it was just age coming," she says with a smile. "My doctor said it was normal, part of aging, and that I should get used to limitations." But Hannah refused to accept this answer as definitive for her situation. After researching vitamins for muscle strength, she started taking the trio of vitamins we discussed. In just 1 week, she felt a surprising difference in her legs. After a month, he was climbing stairs without having to stop to rest every few steps. "The change was like overnight," she says emotionally. "My legs no longer looked like they were made of lead. I felt lighter, stronger, safer." Anna now walks daily in the park near her home, and climbing stairs is no longer an obstacle. Carlos went from barely being able to stand for 5 minutes to dancing with his wife again on Saturday nights, all because he discovered that it wasn't age that was the problem, but rather 3 specific nutritional deficiencies that no one had mentioned before. Her story inspires many. Carlos is 73 years old and has been diagnosed with peripheral neuropathy. His feet were constantly numb, and he had trouble feeling the ground when walking. His balance was so compromised that he had to use a cane even at home. Your neurologist prescribed vitamin B12 in therapeutic doses along with vitamin D3. "In the first 10 days, I didn't notice much difference," confesses Carlos. But after 2 weeks, something started to happen that seemed miraculous. Sensitivity began to return to his feet gradually. His balance improved significantly, and he was able to walk around the house without his cane. After a month, Charles was dancing again with his wife on Saturday nights. "My neurologist was impressed with my recovery," he says proudly. He said he rarely sees such rapid and significant results with vitamin supplementation alone. Today, Carlos maintains a strict supplementation routine and says he will never be without his vitamins again. Maria is 65 years old and has worked as a nurse all her life. Ironically, while taking care of the health of others, she neglected her own. "In recent years, I felt extreme fatigue in my legs even after light activities. I could barely shop at the supermarket," she recalls ruefully. "I had to stop at each aisle to rest my legs, which seemed to weigh tons." Maria attributed the problem to overwork and long years of standing in the hospital. Her colleague, also a nurse, suggested that she check her levels of vitamin B1, thiamine. The scan confirmed a significant deficiency, and Maria began supplementation immediately. The results exceeded all her expectations and transformed her quality of life. "In just 5 days, I felt an incredible difference in the energy of my legs," she says excitedly. "It was like someone had recharged my batteries. I could stand and walk without that terrible feeling of weight." Today, Maria walks 5 kilometers every day and has returned to work part-time at the hospital. These stories represent only a small sample of the transformations possible with the right supplementation. Thousands of seniors across the country are rediscovering their mobility and independence thanks to these 3 essential vitamins. And you could be the next to experience this transformation. But before you start any supplementation, there are some important safety advice you need to know. Like any powerful tool, vitamins need to be used with knowledge and caution. Let's discuss essential precautions to ensure safe and effective results. Attention! What you need to know before starting this revolution in your legs. Vitamins are effective in revitalizing health, but they require careful use. Before supplementing, it is crucial to take precautions, especially after the age of 60 and when using other medications. Never increase the dose without medical advice. More does not mean better. High doses of vitamin D3, for example, can cause toxicity, affecting calcium, kidneys, and even causing mental confusion. Kidney or liver problems make it difficult to eliminate excess vitamins, increasing the risk of adverse effects. Therefore, consulting a doctor before taking supplements is essential. Side effects such as tingling caused by too much vitamin B6 should be monitored. Supplementing vitamins is like driving a powerful car. You have to respect the limits. Too much vitamin D3 can cause headaches, cramps, and loss of appetite. Small changes in the body after starting supplements should be noted. Blood tests every 6 to 12 months help maintain safe and effective levels. Vitamins can transform your mobility and strength as long as they're used correctly. Vitamin B12 improves nerves and balance. Vitamin D3 strengthens bones and muscles. Vitamin B1, thiamine, restores energy and endurance. These 3 together create a powerful trio for your health. Action is the first step to regaining strength and movement. Stories like those of Anna, Carlos, and Maria show the real benefits of correct supplementation. Strength in the legs means quality of life and independence. It is never too late to strengthen yourself again. Vitamin B1 fights slow muscle metabolism, common in the elderly. Factors such as age, medications, alcohol, and poor diet cause its deficiency. Studies show that supplementing with B1 improves energy and endurance in days. It supports the Krebs cycle, produces ATP, and strengthens muscles and nervos.com. Orientation and regularity, it is possible to regain vitality in the legs,